Hello, good afternoon, everyone. My name is Roshan Sharma, nurse educator at Western Sydney Nursing Home. Today, I am going to presentation on COVID-19 pandemic and its challenge to provide care to palliative patients at Western Sydney Nursing Home. The COVID-19 outbreak devastated Australian health system and caused great losses to families, communities, and the economy. Providing safe and effective palliative care during the COVID-19 pandemic presented significant challenges for healthcare professionals, families, carers, and patients. Palliative care providers showed resiliency and adaptation throughout the pandemic to ensure patients with life-limiting conditions received the assistance they needed. Here are few strategies that Western Sydney Nursing Home required to adopt palliative care delivery during the COVID-19 pandemic. To protect palliative patients from exposure risks, telehealth and virtual consultation were implemented during the COVID-19 pandemic, such as remote assessment and other digital platforms, such as phone calls, Zoom, FaceTime. On the other hand, digital channels also allowed palliative patients to communicate virtually through phone calls, FaceTime with their families and their loved ones. This ensured emotional and psychological support and prevented palliative patients from psychological distress such as social isolation and loneliness. Additionally, this strategy is the strain on healthcare resources while enabling patients to obtain care remotely and aim to improve palliative patients' quality of life. Moreover, telehealth services allowed medical providers to deliver treatment more effectively and with fewer resources. Another strategy adopted at Western Sydney Nursing Home was strict infection control measures to protect palliative patients and their families and healthcare workers from COVID-19 virus exposure. These measures included hand hygiene protocols, personal protective equipment, physical distance, limiting palliative patients' movement, implemented isolation protocols, and regular cleaning and disinfection of palliative facilities. During pandemic, restriction or limitation on inpatient visitors during end-of-life situation to reduce transmission risks, palliative care providers put into effect appropriate protective measures such as masks, face shields, and gowns. Depending on specific criteria, the risk of exposure was limited or no visitors were allowed in palliative care. Another strategy that palliative care providers adopted during pandemic was collaboration between healthcare workers to ensure palliative patients' healthcare professionals' safety. However, social distance and PPE were barriers for providing adequate emotional services and end-of-life care. This strategy was intended to balance patients' comfort and companionship to reduce exposure risks and isolation protocols. Palliative care facilities reduce cross-contamination danger by separating COVID-19 patients from non-COVID-19 patients in specified locations. Staff members and healthcare providers had to additional precaution when caring for COVID-19 patients. Another strategy that was implemented by palliative care providers was educational resources to ensure nurses and families had the information they needed to make informed decisions and prevent themselves from COVID-19 exposure. Educational resources acknowledge palliative patients, their families, and healthcare professionals to understand the risks of health complications caused by COVID-19 virus. To provide effective palliative care and address the complex needs of residents at Western Sydney Nursing Home, we formed multidisciplinary teams to share best practices, knowledge, resources, collaborate with hospitals and general practitioners. Western Sydney Nursing Home emphasized education and training to equip healthcare professionals with the skills and knowledge to provide care and manage symptoms during COVID-19. Nurses working on the front line dealing with COVID-19 faced numerous difficulties such as discriminatory acts and shortage of human and medical resources. The COVID-19 pandemic significantly affected palliative care providers due to lack of knowledge of newly emerged COVID-19 infection, risks of exposure, treatment, and fear of infecting themselves. They were severely affected by limited resources and restriction on patients' freedom and autonomy. There are several ethical issues to consider, but the most significant is the correct management of health resources to provide care for palliative patients and their families. Nurses had to make complex decisions within a short frame of time about resource allocations among palliative patients with diverse and urgent needs. These decisions included which patients should be prioritized and have access to intensive care intervention and which patients should be provided alternative medical interventions. In addition, patients need to be managed in alternative settings or withheld certain medical intervention because of insufficient capacity and inadequate medical resources or lack of resources and staff shortages resulting in such services being reduced or suspended due to infection control measures and changes in service delivery, which resulted in prolonged suffering for many palliative patients as well as an increase in mental distress for their families. Additionally, it has interfered with many patients' access to continuity of treatment. On the other hand, for palliative patients whose prognosis may be limited, the need to receive high quality palliative care conflicts with life preservation. This strategy of limiting visits, unique visits, and social distancing, as well as recent technology and scarcity of personal protective equipment, reduce the burden of ethical dilemmas in some way. Moreover, for palliative care providers feared highly infectious COVID-19 exposure, which interfered with the quality of care, equity, fairness, and efficient allocation of scarce resources among palliative patients. Palliative care often involves multidisciplinary approaches. However, due to possibility of infection, palliative patients were unable to get adequate or required support. There was less interaction with palliative care residents due to exposure risks. As a result, this led to a decrease in palliative patients' quality of care, which made it more difficult for healthcare professionals to address the needs and preferences of palliative patients. In addition to the workload, limited resources, and witnessing COVID-19 suffering and loss, nurses were faced with ethical challenges which negatively affected their well-being. Despite this, they strive to maintain of care professionalism and support for palliative patients and families. Effective communication between family members, caregivers, and doctors is essential to providing high quality of palliative care for patients and understanding the nature of palliative care. Advanced care planning. Communication facilitates the patient and healthcare bond and fosters trust between palliative patients and Western Sydney nursing home health professionals to make informed decisions. This enables palliative care providers to understand the priorities of the palliative patients and aids in their ability to make informed decisions regarding their treatment. Psychological, physical, spiritual needs and preferences with acceptable outcomes. Advanced care planning enables end-of-life care along with family carers' satisfaction with quality of care. Furthermore, effective communication promotes interdisciplinary team cooperation, advanced care planning, patient-centered treatment, well-informed decision-making, and informed emotional well-being for palliative patients. Effective communication is crucial in advanced care planning as it reduces unnecessary transport to acute care and unwanted treatment for palliative patients. This aims to clarify and convey a person's values and preferences relating to medical treatments and facilities, navigating complications and ensures compassionate end-of-life care. Medical information, care planning, and compassionate communication enable healthcare providers to understand their treatment process. This includes potential risks, benefits, and limitation of various medical treatments. Additionally, because of strict infection control measures and the risks of the exposure, the COVID-19 pandemic created restricted visiting regulation and reduced face-to-face interaction, which posed a challenge for palliative patients to implement advanced care plan effectively. Therefore, in the COVID-19 pandemic, effective communication plays a significant role delivering palliative care and facilitating palliative care during COVID-19. Palliative care is not just about managing physical symptoms, it also ensures to provide psychological, social, spiritual support. So the empathic and compassionate conversation ensures that it alleviates anxiety, fear, and distress, providing a sense of comfort and reassurance to palliative patients and their families, friends, carers, next of kin, and loved ones. Thank you.